Is it healthier to ejaculate regularly or doing things like No Nut November? Interesting question. Could popping a pimple simply in the wrong spot actually kill you? What's up with eye floaters? And should you consider No Nut November? Huh? That's right, we're tackling the most unusual, bizarre, and embarrassing medical questions you've always wanted to ask. Trust me, you won't want to miss these. All right, let's dive right in. Is it true you could die from pushing too hard on the toilet? Yes. What I'm talking about here is something called a Valsalva maneuver, where you actually pass out. When somebody's pushing really hard, you're contracting really hard in your abdomen and your chest, and you're not really breathing, and that's when the vessels pop out. And what's happening is you're increasing intrathoracic pressure, which basically has to do with vagal or lack of vagal stimulation to slow down your heart. But what could happen is you slow it down so much that you don't have enough blood flow going to your brain and you pass out. Pass out because of the Valsalva maneuver, and you go into an abnormal cardiac rhythm, which if it's not corrected right away could lead to cardiac death, as well as if you just pass out and you fall and crack your head, you can die that way. So in general, you're not going to hurt yourself, but you should not be straining to go to the bathroom. It should be smooth, it should be easy, it should not be hard. If you have abnormal stool patterns, maybe talk to your doctor about it. Hi, I have a problem. I just turned 20 recently and I just stopped growing. Everyone in my family, excluding me, is tall. I have also been diagnosed with hyperthyroidism recently, but I need to know, is there a way to grow my height? Well, yes, but if everybody else in your family is tall and then you unexpectedly stopped growing, maybe there's something you need to look into. Maybe there's a hormonal imbalance. Now, you mentioned that there's hyperthyroidism. Hyperthyroidism is related to the thyroid gland that sits here in your neck. There people could be hyper or hypo. Hyper means it's overactive, producing too much thyroid hormone. What happens is when you have hyperthyroidism, it increases your metabolic state, which then could accelerate within your growth plates the closure of them, leading to decrease in bone growth, and then thus you stop growing. So it's something you need to talk to your doctor about and address. There are medications that somebody would go on if they have hyperthyroidism, and it has to do with down-regulating it, and there's multiple different medications. But talk to your primary care doctor and maybe get in to see a specialist, somebody called an endocrinologist, somebody who deals with hormones of our body. Are there any studies suggesting that people who work night shifts are at a higher risk of developing cancer? Unfortunately, there are. So basically, when people work overnight, what happens is it's disrupting your circadian rhythm. And so during the time that we're sleeping, having DNA repair, cellular cleanup, your sleep-wake cycle is disrupted or not on appropriate patterns. Your ability to repair your DNA when there might be an error, which occasionally happens, might be impaired, thus increasing your risk of cancer. What we'll end up doing is we'll put down a couple studies in the description below that would give you examples of this and the studies that they have done. Is it healthier to ejaculate regularly or doing things like No Nut November have benefits? I've always heard more is better.
Is that a hair gel?
First, I'm going to say more is not always better. But what is No Nut November? For anybody who doesn't know, basically, it's a time period challenge of no ejaculation during this time period. Are there health benefits to it? Better sleep, more mental clarity, and maybe increased amount of testosterone. But if people don't ejaculate, you do have a buildup of sperm. And so your body might actually have more nocturnal emissions. So nighttime ejaculations when you're sleeping to have that turnover because you continue to make sperm every single day. So to answer the question, it's really a personal choice of what you want to do. Are you going to cause harm one way or the other? Not necessarily. If you're having any questions relating to your own personal health, talk to your healthcare provider. How can a tick bite make a person unable to eat red meat anymore? Is it permanent? Yes, because some ticks, some more than others, like the Lone Star tick, they release a molecule called alpha-gal. And so this is a type of sugar molecule that our bodies end up actually reacting to, and reacting as if it's foreign, which leads to an allergic type reaction and can lead to anaphylactic reaction. And so this molecule is found in red meats. And so that is why when individuals, after they've gotten bitten by a tick, potentially have this syndrome where they can't eat red meat because they develop an allergic type reaction, can last a few months or several years. Is it true that stress actually shrinks the brain? Yes, but very specifically in the area of the hippocampus of your brain, what has to do with memory, where the hippocampus goes through a process called neurogenesis, where it's like making new connections in the neurons. When you have increased stress in your body, you release an increased amount of cortisol, and cortisol inhibits neurogenesis, thus almost inactivating your hippocampus, thus shrinking it. So avoid that chronic stress and make sure that you're doing things to release the stress out of your body. And you're looking for calm vibes, I formulated a supplement called Chillax. It's got niacin, calcium, magnesium, L-theanine, saffron. It will positively help your mood and support the occasional life stresses. So definitely check it out at lifehappens.com or on Amazon. What would happen if your entire tongue was cut out in, say, an accident? Life would be pretty hard, but still able to function. Your tongue is for speech, taste, articulation, controlling saliva, expression, multiple different things. And so if you don't have that, you're gonna have a really difficult time. It's a very highly specialized and large muscle. So then you think, okay, can you have a transplant of a tongue? I haven't seen that or heard of it because this would be a rare event, but medical science is wonderful and always evolving, but it could be quite complex to try to get a muscle into you're reconnected into your nervous system, so that way you'd be able to have it function appropriately with your brain. So I see it as quite difficult, but maybe it's possible. If you drink coffee or alcohol but want to feel the effects faster, like if you want to get drunk faster, should you shoot it up your butt with a turkey baster? Are there any benefits of this? Thanks for humoring my curiosity, doc. I do not recommend it. Because of the rectal tissue and the vessels that are down there, what ends up happening is it has to do with like a first and second pass going to your liver. So it goes directly into your bloodstream, bypassing your digestive system. Very risky. Lot of consequences, could be toxic, could be fatal because of the quick absorption and again how the alcohol gets absorbed into the body, and just the dangers of increased risk of perforation of your bowel, as well as the irritation of the alcohol in that area. So at the end of the day, please, if you're going to use coffee or alcohol, just ingest at the normal end and not the other end. Curious question, should you floss before brushing your teeth or after? I've always flossed after, but now reconsidering which is the better way to live. Flossing your teeth allows you to break up the debris between your teeth, get any food particles out of there, move any of the debris that's been left over, and allowing any fluoride to get in there. And some dentists may debate this, and if you do floss, make sure that you floss before brushing your teeth. But in general, this is the recommendation. Do you guys floss before or after brushing your teeth? Let me know in the comments. I got sick and I didn't lose my sense of taste, but my sense of taste changed drastically. Like coffee started tasting too sweet and gross, and while I used to love spicy foods, it's too spicy for me now. What the heck? How does that happen that your taste buds just change? Well, it's a great question, and sorry, hopefully it comes back. When you get sick, your sense of taste and smell does potentially change. It has to do with like your taste buds as well as your olfactory system, so your smell. And it has to do with the fact that you're congested and it's interfering with the nerve impulses and transmission. So if your nasal passages are congested or swollen or inflamed, it can drastically change how your body interprets the food or the smells. Let me know in the comments if any of you have experienced the change of taste and smell after getting an illness. I recently started getting eye floaters. What are they exactly, and am I going blind? When people say eye floaters, usually they see something like black moving in their vision, but like a small piece, and then they look at it, it kind of moves away. It's actually these solid pieces of it that are kind of breaking off and liquefying, and so you're seeing the reflection as it breaks off and changes. If you have almost like a curtain coming down, that is concerning for a retinal detachment, and you need to see an ophthalmologist ASAP within 24 hours, and they can do lasers to tack it back up. In general, if you have anything new eye abnormality, your eyes are so specialized, go get checked out, and that way you can have a professional who does this for a living look at your eye, look in the eye, and tell you what it is. Needs to get checked out ASAP. I had a friend go in for a colonoscopy and they came out and couldn't speak for months because the tube or whatever they used to sedate them messed up their vocal cords. How does this happen? When you're typically having a colonoscopy or an endoscopy, you don't necessarily need to be intubated. Intubation is when we put a breathing tube through your vocal cords and a tube sits right there. That could cause irritation to the vocal cords and can cause issues to individuals when it comes to talking, but it should come back. The vocal cords are muscles, and so if there's any medications relating to weakening the muscles or irritating, that could happen as well. Other reasons would be if there's like a polyp on there, if you're a singer, if there's an infection or a virus, that can cause that as well. So in severe cases, you could have vocal cord paralysis or damage, and this needs to be seen and evaluated by an ear, nose, and throat doctor. Hypothetically speaking, can someone internally combust? We are very awesome, great specimens. We cannot just internally combust. We can't just explode from the inside. Everything fall apart? No, our bodies don't work that way. Can popping a pimple in the danger triangle of your face really kill you? Actually, yes. And why is it dangerous? It's dangerous because things in this area could then track into your cavernous sinus within your brain. And so it can increase the risk of cavernous sinus thrombosis, which is a clot in the brain, which then could kill you. So basically, it's an infection from the popping of these pimples that spreads inward into the face, into this cavernous sinus, which is very hard to diagnose because you need an MRV. You need a doctor to very specifically be looking for this in these diagnoses. It's not a common study that is done. How does being cryogenically frozen work? Do you think they will ever be able to bring back people who did that in the future?
It's freezing in here, Mr. Biggles.
Interesting question. So cryogenically being frozen is when you actually cool somebody's body down to like super extreme cold temperatures. This is done after they have died, but I guess the idea is then maybe if there was a medical issue or a really great medical technology that you can then thaw the individual and revive them from whatever killed them. I'm not sure it's going to work. So the body is stored for extreme cold temperatures. Do you guys out there want to be cryogenically frozen? Let me know in the comments. So if you guys enjoyed this video, definitely check out this playlist right here. Binge watch everything. And as always, do me a favor, subscribe and turn your bell notifications on and hit that like button for me. Thank you so much for watching and stay healthy, my friends.